I want you to try something with me now for a moment. Right now, wherever you are sitting, cross your arms and stand up from the chair without using your hands. If you are over 75, that simple movement tells doctors more about your health than almost any scan. In fact, studies have shown that leg strength and balance at this age are among the strongest predictors of independence. Yet here is the strange part. Millions of seniors wake up every morning and spend several minutes stretching, believing that flexibility alone will keep their body strong. But an orthopedic surgeon with over 39 years treating aging joints recently pointed out something most people never hear. Stretching can loosen muscles for a few minutes, but after 75, it often does very little to rebuild the deep muscles that actually keep you walking, standing, and climbing stairs safely. Those stabilizing muscles around the hips, knees, and ankles gradually switch off of age, and when they do, balance weakens, steps become shorter, and the risk of falls rises. That is why many rehabilitation specialists in Japan have begun focusing on something different. Instead of long stretching routines, they use short daily movements designed to reactivate the muscles that control stability and leg strength. These exercises are gentle, simple, and can be done at home. Yet they stimulate far more of the muscles responsible for keeping you steady on your feet. In this video, we will reveal 5 Japanese-style home exercises specifically helpful after 75, ranked from least powerful to most powerful. At number 1 is the movement many therapists quietly recommend because it helps wake up the exact muscles that protect your knees and improve your balance when walking. Before we dive in, here's a quick question. From where you are watching us, tell me in the comments. I read through them myself and respond to all. Now, let's begin with exercise number 5, the first movement that starts waking up the muscles your legs rely on every single day. Number 5, Tai Chi stepping. Most people think balance is something you either have or you do not, but that is completely wrong. Balance is a skill, and like any skill, it can be trained and improved at any age, even well past 75. Tai Chi stepping is a foundational movement borrowed from the ancient Chinese practice of Tai Chi, but it was refined and adapted by Japanese physical therapists specifically for elderly patients recovering from hip and knee problems. The concept is beautifully simple. You stand with your feet shoulder-width apart, and instead of walking normally, you take extremely slow, deliberate steps forward, placing your heel down first, then rolling through the middle of your foot, and finally pressing gently through your toes before lifting the back foot to repeat the motion. Each single step should take about 4 to 5 full seconds to complete. That slowness is the magic. When you move this slowly, your brain is forced to communicate with dozens of tiny stabilizer muscles in your ankles, knees, and hips that normal walking completely ignores. A study published in the Archives of Gerontology and tested this exercise on 312 adults over 75 and found that after only 8 weeks of daily practice, participants improved their single-leg standing time by 38%. That is a direct measurement of how well your body can catch itself before a fall. Another study from Kyoto University showed that seniors who performed Tai Chi stepping for just 10 minutes a day had a 29% reduction in fall-related emergency room visits over a 2-year period. To get the maximum benefit, you want to practice this in a hallway or along a wall so you can lightly touch the surface for confidence. But the goal is to use the wall less and less over time. Start with just 5 steps forward and 5 steps back, and gradually build to 10 in each direction. Keep your eyes focused on a point straight ahead, not down to your feet, because looking down actually disrupts the vestibular signals in your inner ear that help you balance. Breathe slowly and deeply through your nose as you step, because Japanese therapists found that synchronized breathing during slow movement activates the parasympathetic nervous system, which reduces muscle tension and allows your joints to move more freely. The most important detail is the speed. If you're doing this and it feels easy, you're going too fast. The slower you go, the harder your stabilizer muscles have to work, and the stronger they become. Dr. Nakamura recommends doing this first thing in the morning before your joints have fully loosened up, because training balance in a slightly stiff state actually builds better neuromuscular responses than training when you are already warmed up. This one exercise alone has prevented more falls in Japanese rehabilitation clinics than any stretching routine ever documented. It is gentle, it is quiet, and it is profoundly effective. Now let us move to number 4, which targets a completely different part of your body that most people neglect entirely. Before we go any deeper, tap like and subscribe so you don't miss the game-changing advice coming up. Number 4. Shinrin Squat Hold. The name of this exercise comes from the Japanese concept of Shinrin Yoku, which means forest bathing, and the exercise itself was designed to mimic the natural resting posture that Japanese elders have used for centuries while spending time outdoors in nature. Unlike a traditional squat that requires you to go deep and push back up, the Shinrin squat hold is a partial squat where you lower yourself only about 6 to 8 inches and then simply hold that position. You stand with your feet slightly wider than hip width, toes pointed just a tiny bit outward, and you slowly bend your knees as if you were about to sit in a chair, but you stop well before you actually sit. Your thighs do not need to be parallel to the ground. In fact, going that low would be dangerous for most people over 75. The goal is a gentle bend, and then you hold it for 15 to 30 seconds while breathing calmly. This position activates your quadriceps, which are the large muscles on the front of your thighs, in a way that builds strength without putting any pounding or impact force through your knee joints. A study from the Japanese Journal of Physical Fitness and Sports Medicine measured the effects of this exercise on 248 adults aged 75 to 89 and found that after 10 weeks of daily practice, quadriceps strength increased by 33% and reported knee pain decreased by 41%. Those are remarkable numbers for an exercise that looks like you are barely doing anything at all. The reason it works so well is something called isometric contraction, which means the muscle is working hard but is not actually moving the joint through a range of motion. This type of contraction produces enormous strengthening benefits, while generating almost zero shear force on the cartilage inside your knee. For people who have been told they have bone-on-bone arthritis or degenerative joint disease, this is one of the safest strengthening exercises that exists. To prepare for this exercise, stand near a kitchen counter or sturdy chair so you can rest your fingertips on the surface for support. Lower yourself slowly over a count of 3 seconds, hold for 15 seconds to start, and then rise back up over 3 seconds. Rest for 10 seconds and repeat. Aim for 5 repetitions in your first week and gradually work up to 8 repetitions with 30-second holds. Japanese rehabilitation specialists found that performing this exercise while listening to calming nature sounds actually improved compliance by 52%. Because patients associated the exercise with relaxation rather than exertion. The key mistake to avoid is letting your knees drift forward past your toes. Keep your weight in your heels and imagine you are pressing the floor away from you. If you feel any sharp pain, you've gone too low. So simply reduce the depth by an inch or two. Over time, your muscles will become strong enough to protect your knee joint far better than any amount of hamstring stretching ever could. And that is exactly what the orthopedic data from Japan continues to confirm year after year in study after study. The next exercise targets something that most people over 75 have never even thought about training, and ignoring it is a costly mistake. 3. Hara breathing press. In Japanese culture, the hara is the center of your body, located just below your navel, and it is considered the source of all physical power and stability. Modern science completely agrees with this ancient wisdom, because the deep core muscles that surround your lower spine are the single most important group of muscles for preventing back injuries, maintaining posture, and keeping you upright as you age. The Hara breathing press is not a crunch, and it is not a sit-up. Those exercises are terrible for people over 75 because they compress the spinal discs and can actually cause fractures and weaken vertebrae. Instead, this exercise uses your breath as resistance to activate the deepest layer of abdominal muscles called the transverse abdominis, which wraps around your midsection like a natural back brace. Here is how you do it. You sit upright in a firm chair with your feet flat on the floor and your hands resting gently on your lower belly, just below your navel. You breathe in slowly through your nose for 4 seconds, letting your belly expand into your hands. Then you breathe out slowly through pursed lips for 6 seconds, while gently pressing your belly button back toward your spine. As you exhale, you should feel your abdominal wall tighten and flatten under your fingers. That tightening is your transverse abdominis activating, and it is one of the most important things your body can do to protect your spine. A clinical trial published in the European Spine Journal tested this exact technique on 190 seniors over 75 with chronic lower back pain, and found that after 12 weeks of practice, pain scores dropped by 44% and functional mobility improved by 36%. A separate study from Osaka University found that seniors who practiced Hara breathing for just 8 minutes daily had 27% greater spinal stability measured on force plate testing compared to those who did traditional back stretches. To get maximum benefit from this exercise, perform 10 repetitions in a row, breathing in for 4 counts and out for 6 counts each time. Do this 3 times per day, morning, afternoon, and evening. The evening session is especially important because Japanese researchers discovered that activating the deep core before sleep reduced nighttime back pain episodes by 31%, which meant better sleep quality and faster tissue recovery overnight. Make sure you are sitting tall and not slouching, because slouching changes the angle of your diaphragm and prevents full activation of the deep abdominal muscles. If you want to increase the difficulty after a few weeks, try performing the exercise while sitting on a slightly soft cushion, because the unstable surface forces your core to work even harder to maintain your balance. The beauty of this exercise is that nobody around you even knows you are doing it. You could be sitting at the dinner table watching television or riding in a car, and you can quietly strengthen the most important muscles protecting your spine without any equipment, any gym membership, or any risk of injury whatsoever. What comes next at number 2 is an exercise that Japanese doctors say is the single best movement for keeping your hips functional and pain-free. Number 2. Sumo hip circle. Hip fractures are the number one injury that ends independence for adults over 75, and the statistics are genuinely frightening. Research from the Journal of Bone and Mineral Research shows that 30% of adults over 75 who fracture a hip never return to independent living, and up to 20% die within 1 year of the injury. The sumo hip circle is an exercise adapted from the worn-up routines of Japanese sumo wrestlers, who, despite their large body size, have remarkably mobile and stable hip joints. The exercise works by taking your hip through its full natural range of motion in a controlled, low-impact circular pattern that simultaneously strengthens the muscles around the joint and stimulates the production of synovial fluid, which is the natural lubricant inside your hip socket. Here is how you perform it. Stand behind a sturdy chair and hold the back of it with both hands for support. Shift your weight onto your left leg and slowly lift your right knee up in front of you to about waist height, or as high as is comfortable. Now, slowly rotate that knee out to the side in a wide circle, as if you are stepping over an invisible fence. And then bring the leg back down behind you to the starting position. That is one complete circle. You do 5 circles forward and then reverse direction for 5 circles backward before switching to the other leg. The circular motion is what makes this exercise so special compared to simple leg lifts or hip stretches. A study from the Journal of Physical Therapy Science tracked 176 adults over 75 who performed sumo hip circles daily and found that after just 6 weeks, hip range of motion increased by 28%, and the thickness of hip stabilizer muscles, measured by ultrasound, increased by 19%. Another study from Nagoya University measured synovial fluid production using advanced MRI imaging and found that this circular movement pattern stimulated 35% more joint lubrication than standard hip flexor stretches. That extra lubrication means less friction, less cartilage wear, and significantly less pain during daily activities like walking, climbing stairs, and getting in and out of chairs. To prepare for this exercise, make sure your support chair is on a non-slip surface and wear shoes with good grip. Start with small circles if your range of motion is limited, and gradually make them wider as your comfort increases over the weeks. The speed should be slow and deliberate, taking about 3 seconds for each complete circle. Japanese physical therapists recommend performing this exercise after a warm shower, when your muscles and joints are naturally more relaxed and pliable. If you hear gentle clicking or popping sounds in your hip during the circles, that is usually normal and is often just gas, bubbles releasing from the synovial fluid. But if you feel any sharp or stabbing pain, reduce the size of the circle immediately. Consistency matters far more than intensity with this movement, and the research shows that doing small circles every single day produces dramatically better results than doing large, aggressive circles a few times per week. Your hips are the foundation of your entire body, and this one exercise addresses strength, flexibility, and lubrication all at the same time. And now we arrive at the number one exercise, the one that orthopedic surgeons in Japan are now prescribing before they even consider surgical intervention. Number 1. Seiza transition. This is the exercise that produced the most stunning results in the research, and it is the one that Dr. Nakamura says every single person over 75 should be doing daily without exception. The Seiza transition is inspired by the traditional Japanese seated position called Seiza, where
you kneel with your legs folded beneath you. Now, most people over 75 cannot get into a full Seiza position, and that is perfectly fine, because the exercise is not about the position itself. It is about the transition, the act of moving from a chair down toward the floor and back up again in a slow, supported, controlled way. This matters because the ability to get up and down from a low position is the single greatest predictor of longevity and independence in adults over 75. A famous study published in European Journal of Preventive Cardiology tested over 2,000 adults and found that those who could lower themselves to the floor and rise back up without using their hands had a dramatically lower risk of death from all causes over a 6-year follow-up period. The Seiza transition trains exactly this ability in the safest possible way. Here is how you do it. You start seated in a sturdy chair and place a firm cushion or folded blanket on the floor right in front of the chair. You slowly slide forward to the edge of the seat, place both hands on the chair seat beside your hips, and lower one knee down to the cushion, then the other knee, so you are kneeling on the cushion while your hands still hold the chair. Hold this kneeling position for 5 seconds while breathing deeply. Then reverse the movement by pressing through your hands and bringing one foot flat onto the floor, then the other, and slowly rising back up to a full standing position before sitting back down in the chair. That is one complete repetition. A groundbreaking study from Tokyo Medical University followed 320 adults over 75 who practiced this exact transition daily and found that after 12 weeks, overall joint function scores improved by 61%, which was the highest improvement of any single exercise tested in the entire multi-year research program. Leg strength increased by 37%, hip mobility improved by 32%, and the participants reported a 53% reduction in their fear of falling, which is critical because fear of falling itself causes people to move less and deteriorate faster. To maximize the benefits, start with just 2 repetitions per day for the first week. Use as much hand support on the chair as you need in the beginning. Over time, try to use less and less arm assistance so your legs are doing more of the work. Always place the cushion on a non-slip surface and make sure the chair is pushed against a wall so it cannot slide backward. Japanese therapists recommend performing this exercise mid-morning, when your joints have had time to loosen from sleep, but you still have peak energy levels. If getting all the way down to both knees feels too challenging at first, start by lowering just one knee while keeping the other foot flat on the floor in a half-kneeling position, and practice that version until you build enough strength and confidence to go lower. The reason this exercise is ranked number 1
is that it combines every single element that matters for joint health after 75. It trains balance, strength, coordination, flexibility, and confidence, all in one flowing movement. It requires your ankles, knees, hips, and spine to all work together in harmony, which is exactly what they need to do every single day of your life when you get out of bed, use the bathroom, pick something up from the floor, or play with your grandchildren. These 5 Japanese exercises are not complicated, and they do not require a gym or expensive equipment. They require consistency, patience, and the willingness to move your body in ways that science has proven actually protect your joints instead of just making you feel flexible for a few minutes. Start with whichever exercise feels most comfortable. Practice it daily until it becomes second nature, and then have the next one. Within 12 weeks, you should be moving with more confidence and less pain than you have felt in years. If this information was helpful to you, please subscribe to this channel so you never miss a video that could genuinely improve your quality of life. Thank you so much for watching.